My name is Claradina Soto, and I'm a faculty member in the Department of Population and Public Health Sciences at the Keck School of Medicine. My research focuses on the health inequities and health disparities with American Indian and Alaska Native populations, primarily working with tribal communities and urban Indian populations to really work with addressing mental health, cancer health disparities, developing programs such as vaping interventions, cessation programs, particularly for Native teens, and really addressing and developing culturally specific programs, interventions to address the needs of the American Indian Alaska Native community. What sparked my interest is being Native. So I'm Native American, I'm Navajo and Jemez Pueblo, and realizing there are not many Native scholars addressing these issues in the communities. And so knowing that there's not a lot of data that exists for this community, that really was the pivotal point to have data to understand the need and to understand the positive impacts we're making with the community. The real-world impact is including our communities, to have data, to be able to provide programs, to be able to advocate, to be able to have policy changes. And this is at the local level, county level, state level, and tribal level. So there's so many impacts here as it's, again, inclusive of our communities to have real-world implications, policies, and programs and interventions to make a real-world impact. My favorite part about the research is the community-based approaches, and that is working with our communities and partnering and working with them directly. And so this is not only leaders, but this is the tribal communities and within the urban Indian populations, because their voice needs to be heard. Their perspective is so important in all of the work that we do to ensure that their needs are being met in public health, in policy, and other levels that really deserve that attention. So that really is my favorite part, is having their voice included. In our public health work, especially working with specific populations, it's important to have them included in that process. Particularly in my work with American Indian and Alaska Native communities, we want to be culturally appropriate and when working with them in ensuring that they are part of the conversation, that they are part of our research design, as well as in the development, as well as in the dissemination of the work that we do. They are the partners, they are the ones that we are trying to reach, so ensuring that our public health work is not only reaching the community, but it's also including them and having the voice of the community.